No restrictions are easing after a steady decline. COVID-19 case counts, unfortunately, are going up again. It is a trend being seen around the country as well as in all 3 states in our region. At the same time, there's been a steady increase in vaccinations. Health reporter Stephanie Stahl is here with the update now from Philadelphia officials. Hi, Stephanie.
Hi, Jessica. It will be 1 year tomorrow, the 1-year anniversary when the first COVID case was confirmed in Philadelphia. And while the virus has killed more than 3,000 city residents, the health commissioner says precautions and restrictions have saved just as many.
Overall, it's been a long, difficult year for everyone. More than 120,000 people have been known to be infected.
The health commissioner says the daily coronavirus case count had been down to 250 and is now up to 330, much lower than the surge, but going in the wrong direction. He says he's hoping to avoid new restrictions.
As much as possible, we'd like to try to address that by just reminding people that they shouldn't let down their guard right now. We need to try to reinforce the message around masks and staying away from people through indoor gatherings.
But Dr. Farley says he's optimistic about better controlling the virus with a continued increase of vaccine to the city. Philadelphia has now administered 421,000 doses and is planning to open new, more community-centered vaccination sites.
We have had some problems that have been seen around the country.
The issue being line jumping. People who shouldn't be getting vaccinated are, and those who need it most aren't. The city has now started to call people at high risk and will adjust its software to prevent vaccine invites from being shared. But the issue of people falsely claiming to have medical conditions can't be fixed.
There's no way for us to really verify if someone says I've got diabetes, whether they have it or not. We're asking people to be honest.
And there's an issue with pharmacies not enforcing guidelines.
So the pharmacies are good at getting vaccine out quickly. We have a lot of pharmacies that can deliver a lot of doses in a hurry. They're less good at racial equity, so that is a problem. I would prefer, obviously, that they had a more diverse group that they're vaccinating.
Now, Rite Aid is one of the largest providers and has given a disproportionate number of vaccines to white residents over black residents, and there are more black people who live in Philadelphia. It is also giving more vaccine to people who live outside the city. A spokesperson for Rite Aid says they are working to improve their system. Jessica?
All right, Stephanie, thank you.